So this is what they have. This is the recovery serum, which is used in the clinic. So we do not prescribe this to the patient. You actually do it in the clinic itself. This is the recovery serum that you use after your lasers. It can be a standalone product on its own as well. So how do you actually deliver this standalone product on your own? It's through stamping. Stamping is a very simple process. It's painless. Well, it's very slight discomfort, no blood, and right after stamping, you apply the growth factors, and the patient goes home. Or you've done a chemical peel, or you've done a laser. All you need to do is just take a little bit of the recovery serum, apply it, and then the patient can go home after that. What is contained in the recovery serum, majority is actually growth factors. That's why later when we show you the growth serum, it's actually very thick. It's very, very thick. It's not watery at all. It's so thick that sometimes you have actually problem aspirating from the glass itself. So this is how you actually administer it, which is through stamping. So they have actually trademarked this name called growth factor induction therapy, where through your stamping, you apply the growth factors and it actually improves the skin texture. So this is after CO2 laser. You can't really see properly here. Yeah, so this is the one. This is post laser. This is about a month post laser. Patient did CO2 laser here, and then after CO2 laser, you applied the recovery cream. Patient came back in a month's time. In a month's time, the majority of the acne cleared up, majority of the scars cleared up as well.
After the laser, do you still need the stamping?
No, after laser you do not need a stamping. No, you don't need a stamping at all because you've already damaged the skin. You just need to apply the serum, and then after that you can actually prescribe some growth factor serum creams for them to go home. They just continue using it at home, and then within a couple of weeks, majority of things clears out. It actually reduces the downtime of your fractional CO2.
Peel also.
Peel also, yes, peel also. So from peel, what you need to do is you need to neutralize the peel first before you apply the growth factor. Because otherwise, if let's say you've already done a peel and it's still acidic and you apply the growth factors, it actually kills off the majority of the growth factors. It actually deactivates or kills off the growth factors. Okay. So same thing as well. Patient this is after 2 weeks. Acne scarring, did stamping, purely stamping. Stamping with recovery serum. This is the same patient on the forehead. This is a patient in Indonesia. Came in for acne problem, didn't want to do any procedure at all. This was not done by dermatologist, so she was not given access to Roaccutane. So she came in with a bit of acne vulgaris, a bit of nodules here and there. They did stamping every 2 weeks. So patient came back every 2 weeks and did the stamping. So this was started in March 15, 2012. This is in May. So it's just about 2 months, roughly about 2 months. At the end of 2 months, skin not only cleared up, acne has reduced, scars are very minimal. And no lasers were done, just purely stamping with the growth factor creams. Alright, this was a patient came in with a bit of acne as well, and as well as post acne scarring. This was only two times only was done. This is month 0, when patient came in, first saw the doctor in Jakarta. Patient did the stamping 1 time, came in on the 2nd month, stamping 2nd time, and this is the results are after 2 times only. Alright, so this is an old scar. It was actually from a burn, I think an exhaust burn. It was in 2012. So patient came in, 4 treatments, this was the result. And this is actually my patient, came in for mixed picture of last month. So we did 1 stamping, just a single session. This after 2 weeks. It has reduced a lot. Patient has actually gone through a lot of series of treatments with lasers, with Lomixil, with hydroquinone as well. She complained that every time she has done the laser or she's finished the package, not much has changed in her last month. But we just did 1 session. Okay, this was after plastic surgery. The patient had a very bad cut on the nose. This was done by a plastic surgeon. So on day 1 itself, they have already applied the recovery serum and discharged the patient home with some growth factor creams. And this was day 9, when the sutures were removed, and day 14. So there's almost, you can hardly see the scar. So why was this particular recovery serum created in the first place. It was not meant for cosmetics, it was not meant for aesthetics, it was actually meant for wound healing. They primarily did it on non-healing wound ulcers, for example, diabetic ulcers. So this patient had a very poor healing ulcer, very poor healing ulcer, and tried all these gels, didn't really work for 6 months. Patient came in, applied a recovery serum on every 3 days. Came, applied 1 ml, came and applied 1 ml, and this was right after 1 month. Majority of it has closed, has started to epidemialize, and patient was very pleased. Okay, so now the previous one was a serum for you to, previous one was a serum for you to use in the clinic. So this active serum is the one for you to bring home. Now this has a more stable concoction of growth factors because it's for the patient to bring home. You do not know when you bring home at what room temperature do they keep it in, whether they keep it in the bags, in the car, etc. So this one has slightly lower percentage of growth factors, higher percentage of cytokines. So it's more stable. So it's for patient use at home. It's great for preventing photo-age skin. It's great for reducing wrinkles, increasing moisture. It's great for balancing out the skin color as well. And the users, most of the time, you can use it as a standalone cream. Means patient comes in, wants something for her wrinkles, her pigmentation, and probably fine lines, and she doesn't want to buy a whole bunch of creams. You can just prescribe this to her. Or you have a patient already on your particular regime, your particular protocol, but she wants to speed up the process. For example, patient came in and say, I have this pigmentation I want to get rid of, and I want to make it faster. There's high rise coming up. I want to get rid of it within a month. And you know that a lot of times just usage of creams, it cannot speed up the process too fast. So you can actually add this on. Patient will actually see a faster reduction in whatever they're actually seeking for, whether it's anti-aging, whether it's anti-pigments, etc. Or it can be used post-treatment. It can be paired of growth factors to speed up the results. You can even give it out the fillers for you to extend the lifespan of the fillers, to make sure the skin texture becomes nice. So it can be used alone or it can be paired with any of the treatments in the clinics.